Lots of us reach for some form of CBD to help us sleep. Maybe you pop a quick CBD supplement before bed, or perhaps you prefer weed gummies, maybe even smoking a joint or weed pen. Whatever form or chemistry it takes, the CBD industry makes a lot of claims about the ways it can help with sleep. But is it ultimately good for you? Or like Springfield and the monorail, are we just falling for clever marketing? Let's look a little closer at what the science tells us about CBD and whether it actually leads to real quality sleep. There are a million different terms for Snoop Dogg's favorite plant: weed, dope, ganja, electric lettuce, Mary Jane, doobie, blunt, chronic, dank Sinatra, grim reefer, a little bone, some broccoli, a little British Columbia, some evil edamame. But scientifically, we call it cannabis sativa. Weed plants contain several chemical compounds, but most research focuses on a particular group called cannabinoids. Your body actually produces something called endocannabinoids on its own, and they work a little something like this. Endocannabinoids are molecules that your body makes, and they help your body run smoothly. In addition to these molecules, your body also has receptors called endocannabinoid receptors. You have receptors in your central nervous system, which are called CB1 receptors, and then you have what are called CB2 receptors in your peripheral nervous system. While researchers have identified the molecules, the receptors, and how these govern your body, it's still a super complex process. But we know that, for the most part, these molecules and receptors are responsible for things like your mood, appetite, metabolism, pain, learning and memory, muscle formation, stress, and most importantly, for our purposes, sleep. So when you take CBD or a hit of ganja, it's interacting with these receptors that govern the major nervous systems in our bodies. Now, we should point out that there are over 100 cannabinoids present in one plant, but only 2 seem to affect humans: tetrahydrocannabinol, or THC, and cannabidiol, or CBD. But what's the difference?
My name is Dr. Alex Dimitriu. I'm a practicing psychiatrist and sleep medicine specialist working in private practice in California. Cannabis is considered a psychedelic substance, or a hallucinogen at least. As anybody may know, people from the use of cannabis can become paranoid and agitated and activated and almost in a panicky state. And many of those effects, I think, are actually attributable more to THC rather than CBD. Academically, it's interesting to realize that there is some opposing effect between THC and CBD. Whereas THC can be more activating and possibly make people more agitated, CBD has a more calming effect.
THC is the stuff that gets you high. When you hear someone use the word marijuana, they're referring to the part of the plant containing THC. And you know what that part looks like, don't you? On the other hand, CBD is derived from the hemp plant and contains less than 0.3% of THC. CBD has a calming effect on the nervous and serotonin systems. But outcomes vary depending on product type and dosage. The main difference here is that it doesn't have the same psychoactive properties and does not cause the same high sensation as THC, nor can its effects lead to dependence or abuse. And fun fact, in 2018, the US federal government passed a law that no longer considers CBD a controlled substance. Took you guys long enough. So while yes, CBD has its roots, get it, in the hemp plant, it can legally be sold in the United States. This is why you see an explosion of CBD products in your local market. You can take CBD in gummy form, as a pill, in a tincture, or as a tea. You can apply it as a topical cream or even spray it under your tongue. Dosage-wise, the jury is still out since the FDA doesn't regulate the dosing of non-drug CBD for sleep. However, research has shown that taking upwards of 1,500 milligrams a day showed no adverse effects. In case we weren't clear before, CBD does not get you high. You can take all the CBD gummies in the jar and you'll never feel stoned, maybe just a little bloated. In fact, some studies show that CBD can reduce the psychoactive effects of THC. Most research on medicinal CBD found it most effective at treating people with epilepsy. Other studies suggest CBD can also treat schizophrenia and help with substance use disorders.
CBD has been shown to have benefits for pain. It's been shown to work as an anti-seizure medicine. It may have some antipsychotic properties as well. And I believe it's been used for seizure disorders as well. And it can also help appetite, reduce inflammation, and it has a role in moderating pain, all of which are pretty powerful benefits of a natural substance.
But as it stands, there's not enough research to support CBD's effectiveness in treating other medical conditions. These include sleep disorders like insomnia, REM sleep behavior disorder, and excessive daytime sleepiness, also known as it's 2 in the afternoon and I need a nap. Okay, while we don't yet know how effective CBD is at treating certain conditions, we do know it's quite safe. In fact, most side effects from FDA-approved CBD medications are mild, ranging from drowsiness to diarrhea. Any other negative effects stem from interactions with other meds, so talk with your doctor before taking CBD for sleep. As for whether it helps you sleep, well, research regarding using CBD for sleep disorders is still in its infancy and mostly anecdotal. If we had to capture CBD's effect on sleep in a nutshell, it'd be this. While CBD probably doesn't directly help you sleep better, it can certainly ease the conditions that make it difficult to sleep. For example, some people using CBD for chronic pain reporting having better sleep. And CBD is also helpful at reducing the effects of conditions like epilepsy and PTSD, which can be major factors preventing us from sleeping at night. The issue is that not everyone experiences the same sleep benefits of CBD use, nor do we have a recommended dosage set in stone. Studies found that low doses were stimulating, while high doses acted more like sedatives. How people take CBD, whether gummy, vapor, tea, or cream, can also change the results. So with all of these variables, it's really hard to make solid conclusions and therefore solid recommendations. We can't put CBD will help your sleep on a billboard and call it science. But we can say CBD will help several other things, which in turn can lead to better sleep. For example, there's plenty of good research about using CBD for anxiety. While anxiety isn't technically a sleep disorder, it can still keep you up at night. Since CBD calms the nervous system, early studies show it can treat anxiety. According to one study, 80% of those who used CBD reported lower anxiety levels within a month.
There is some evidence that CBD may work on the 5-HT1A receptor, which is one of the serotonin receptors that some antidepressants work on as well. In particular, the 5-HT1A receptor is acted on by a medicine called buspirone, and that one is known in psychiatry to have an anxiety-lowering effect. And in truth, I think that's really one of the biggest benefits that I stumbled across with CBD, that it does seem to produce benefits to anxiety that are lasting, much the same way as if somebody were taking a psychiatric medication.
Similarly, CBD has been shown to reduce the inflammation that causes conditions like arthritis, while other studies have reported it has moderate benefits for people living with chronic pain. So again, the point is not that CBD necessarily helps you sleep. It's that CBD helps you sleep by helping create the conditions for sleep, which often means it reduces the symptoms of things that prevent us from sleeping. Additionally, CBD has also been helpful for those living with insomnia. These folks often report that they're more tired and stressed during the day, which leads to increased anxiety and trouble falling asleep. It's a vicious cycle, and one that CBD could possibly help. And do you talk or make aggressive motions during REM sleep? Well, you might have REM sleep behavior disorder. It's most common in older patients with Alzheimer's and Parkinson's disease, so if that's not you, pay attention for grandma. A small-scale study gave CBD to 4 Parkinson's patients who experienced REM sleep disorders between 2 and 7 times per week. After taking CBD, their symptoms basically disappeared, at most having 1 weekly episode. Most studies want to know if CBD can help you sleep, but some early-stage research shows CBD can actually keep you awake. As we mentioned, low doses seem to stimulate while large doses can knock you out. This might spell good news for those with excessive daytime sleepiness, assuming more research pinpoints the correct usage and dose.
As with all medications, number one, definitely mention this to your doctor, and don't just do these experiments completely on your own. Let there be a medical professional on board that's monitoring and can give some guidance. The second recommendation I would say is, start low and go slow. If you read the studies on CBD, the doses are mind-blowing, like 300 to 600 milligrams in some cases. And I recommend for all my patients and anybody that's listening to this video, just start with a really low dose. There were some positive studies that showed a good response to anxiety and possibly sleep at doses as low as 25 milligrams. In the end, I think, fundamentally, with whatever dose you try, start with a low dose, get to know it. I also wanted to say, it's really important, I think, for anybody that's looking to self-medicate or take something, certainly it's okay in the short term. And I think we're seeing the same thing is true with sleep medicines. So I think for anybody that's using CBD or sleep meds or alcohol or any other substance, if you're using it chronically, it's a good thing, I think, at some point to speak to a professional and ask yourself, might it be time to kind of do something more about this than treating it on your own?
Will CBD help you sleep? Science says it can, just not directly. Instead, CBD might mellow you out, lower your anxiety levels, and keep you still at night, which can help you fall and stay asleep. Just remember, CBD does not get you high, and the side effects are relatively minor, so you should feel very comfortable trying it out for yourself. You know what else is a relatively safe sleep supplement that many people take? Melatonin. And to learn more about how much melatonin you should take and how it works in your body, click on our video on that right here. Thanks for watching, everyone. Sleep well.